All righty. It is 1 minute to 6 o'clock. So I'm about to just go live and welcome everyone to Moving Beyond Pink, episode 4. Who's on your team? I'm truly excited tonight to welcome my guest this evening and to welcome all of you who took the time to join us for this month, a special month where we um, acknowledge Breast Cancer Awareness Month and acknowledge all the challenges faced by those who have breast cancer and by their family and their friends, the people who support them. So this evening, we have three special ladies. Um, all of them who I can say, I think I can say, I call friends, right? And I all met them in interesting ways. And we all connect in various ways, in various forms, in various groups. And so this evening, I want to welcome, we're going to start with the young lady on my left in blue, Opal Levy. Opal actually is very interesting how I met Opal. She gave me the push, I would say, the push to finally start fulfilling some dreams I had for years, including where we are right here now, the formation of Navigating Health Services. Opal was a business coach that pushed me, helped me to go through the details to ensure that the ideas that I had actually made sense. But it's just interesting how life turns and how Opal entered my life into another phase of her life, which she'll talk about tonight, as she supported her sister Alison through her journey with breast cancer. So welcome, Opal.
Thank you.
Welcome, Dr. Spence, Dingle Spence. Maybe many of you know her lovely face. She's been around helping so many people on their journey. Um, we met, I want to say 9 or 10 years ago now. It could have been up at the Hope Institute when I started volunteering my time up there. Um, and then connected again with regards to the Palliative Care Association of Jamaica and on so many other different levels. And somebody who I consider part of my team, because if I need to make a quick call to figure out something or to send someone somewhere, I know I can always get a friendly response from her. So welcome,
Thank you. Good.
welcome. Kamala, my sister friend. Kamala also just came into my life. You know, we were both featured in both newspapers the same day, same week. And another mutual friend, Latoya, put us together. And Kamala also sat down and listened to all the wonderful ideas I had for years on her little couch in her former bridal salon, discussing all of this. And, you know, it's just funny to me how everything just comes full circle. And Kamala, many of you may know her. She's had her own journeys with breast cancer, but she's also been a great support for others because she's an associate psychologist, but she's also using her experience to touch lives all over. And so I welcome Kamala tonight as well.
Thank
And
you.
I welcome and thank all of you for joining us. So tonight we're going to enter a very interesting discussion about the team. And when we talk about team, we're talking about your support team and we're talking about your care team. And this being Breast Cancer Awareness Month, I wanted to also have us kind of start to think about, when we think about team, to think about the various stages that people go through on this journey. Because remember, we've been discussing from the beginning that this is a journey that people embark on. And so I want to start talking about when you're screening. This month, there's a lot of advertisements, everything out there pushing people to screen, to get mammograms done, to do all the various things that need to get done. But even at that very starting point there, you need support too. Because for some people, going to get screened is a major event. And you do need a team around you too, whether you realize it or not. So we're going to start thinking about that. So from the screening, and then of course to diagnosis. Once you get diagnosed, there's so much that takes place with the individual. And there's so much that takes place with the people around you. So we want to talk about team in that respect too. Who do you need when you're in that space? As you move into treatment, there are other needs that you're going to have, and you're going to need a team to support you for those needs as well. And also for follow-up, to continue to cheer you on, to continue to push you to move forward in your life and start to think about goals and dreams and all the things that you may have put on pause a little bit as you were going through your treatment process. But we also need a team if we're at a stage in our lives where, well, our journey may be ending, and we need a team to support us then too. We do still need care through every aspect of our lives, through every transitional period of our lives. So we need care then as well. So we're going to try and see how we can have a discussion about team, covering the full continuum of care. So we're going to go right into it. I'm going to ask my panelists, as they tell us about what they think the whole team approach to care is about. I want them to tell us a little bit about themselves and then get into what they think team is all about, or what team means to them. Opal?
Okay, hi Patrice, thank you so much for having me on, and hi everyone. Well, I am Opal Levy, as Patrice said, and I wear many hats, but I'll talk about the hat that I was wearing when I met Patrice. And so I'm a director of Sisters Inc., which is a company that I actually started with my sister many years ago. And basically our role was just to help and support entrepreneurs through their own journey. And we've had so many memorable moments, in on that journey. And unfortunately, last year, January, or I think it's January, my sister was diagnosed with stage 4 breast cancer. And it was a very difficult point for both of us, because we had so many dreams. We just had so many things that we were looking forward to, and to get that diagnosis and at one time, it wasn't for a stage 1 or directly to stage 4. And just being with her, carrying her through the journey, and just holding her hand every step of the way. And so I'm very happy to be here today, just to share my successes, my mistakes, so that persons who have the opportunity to be with a loved one during this time, can learn from me and also learn from my mistakes. So thank you so much, Patrice, for having me on.
Thank you, Opal. Dr. Spence?
Hi, good evening, and thank you so much for having me on, Patrice. As you say, we've known each other for a good little while, 10 plus years. So my name is Dingle Spence, and I'm a physician. I run the Hope Institute Hospital, which is a small public sector oncology and palliative care unit. I'm trained in oncology, so that's in giving chemo, giving radiation, and also in palliative care. Yeah, I don't know if we're going to go into talking about teams right now, or are we going to introduce Kamala first?
Well, let's introduce Kamala. Let's do that.
So good evening, everyone, and thanks, Patrice, for having me on. I remember the good old days when we were talking about some of these visions. So it's really gratifying to sit in a space with you that you have been creating, over the last couple of years. So Kamala McQueen is the name. I am officially on October 18th, a 7-year breast cancer survivor. I'm really, really grateful to be able to say that. It was a difficult journey, to say the least. It's still emotional talking about it, but I am convicted and convinced that a part of why I went through it was to help other people. And so I'm very, very open to sharing the details of my journey. I'm really excited to talk more this evening about teams, because that was a huge part of the whole adventure, some of the ups and downs of my journey 7 years ago.
Thank you, Kamala, and thank you, ladies. So, all right, we're going to get right into the conversation. So earlier I asked, I wanted to hear from you ladies, your perspective in terms of team. So what do you feel in general would be needed on a care or support team? Anybody jump in? Kamala, you want to start?
All right. So for me, I have a wish list, right, of what I think an ideal team would look like. One, of course, the oncologists. On my team, I had a surgical oncologist and a medical oncologist. I
Okay.
also had a plastic surgeon. So I would definitely keep those three on the team because those are critical in my mind. But then there were some parts of the journey, Patrice and Opal and Dr. Spence, where, I mean, like going through chemo, for example, I had so many questions about, what to eat, what would be the ideal things to eat more of and to stay away from. And I wasn't
Right.
getting many of those from my medical professionals. So I definitely would put a nutritionist on that team as well. Things like how to manage the nausea. There were drugs that we got to help manage it, but they weren't always effective. So I'm sure that there are other natural things that we could have done. So I longed for that on my team. So a nutritionist would also be an addition for me. Because of the different surgical procedures that I had, I definitely would have wanted a physical therapist to help me through. For example, after removing lymph nodes, from under my left arm, the range of motion was restricted for a while. And I kept on hearing, you need to stretch it, you need to exercise it. But it was scary, right? And it was painful. So just somebody who is skilled in that particular area to help me to navigate how to move the shoulder, how to stretch up, and all these things. And then my survivor sister, Althea, and I went through the journey together. I see her online. Althea is a trichologist and cosmetologist, and trust me, just getting the good rub-up oils for the scalp at the time when we both lost our hair, and just being taught how to manage that part of it, the beauty piece, because I want to look pretty all the time, right? So I think an esthetician would have been a good thing to have had on my team,
Right.
in a more formal capacity. So and as a psychologist, I came to
I was wondering when you were going to.
listen, I came to a point, ladies, where I said to my surgeon, I said, Doc, I don't know that I can survive, that I will survive a mastectomy, that I will survive it psychologically, because it meant so much to me. It was so emotionally upsetting, like it was devastating to me. And the doctors, those who were male in particular, were very blasé. Just cut it off. Just save your life and cut it off. And I remember being listen, I was very combative, right? Where I remember saying to one of my doctors, what have you had surgically removed that makes you say it so easily as if it's just a 1-2?
Yeah.
That kind of pushed the conversation into a reflective space. So definitely a mental health professional is definitely what I think would be a great add to the team as well.
You have outlined a very comprehensive team.
Yeah.
It's my wish list.
I agree with Kamala. I think there are just two other persons that I would add. And I guess because of our faith, I would put on a prayer warrior. Because I mean, there were so many persons who visited and prayed, prayed for Alison, and it gave her this peace and this comfort, during this storm. And then I also believe, and I'm sure Kamala had this individual too, but just somebody who goes on the visits with you, because I know that there are many times the doctors are talking to Alison and I guess it's going through one ear and coming to the next. So I had to document everything in terms of, what she's supposed to do, the different medications that she's supposed to take, etc. So those are just the two additional persons that I would add to the team
So you're
me.
saying that if not a family member or caregiver, a company, you need a navigator to accompany you. That's what you're saying.
Definitely.
Definitely, yeah, because I mean, I say that because I know it's still a new term here. And I think, I don't know, maybe Dr. Spence can help me on this, but I'm not sure yet if a number of physicians are open to having somebody like that in their space, like with an appointment, because it may be a bit weird, I guess. It's not a family member, it's just this person sitting here who, maybe taking notes or maybe, asking questions and we're going to get into that too, because you have to operate based on the permission of the person who is having care. So if that person has asked someone to be that person to speak on their behalf or to ask questions on their behalf, that is a very critical member of the team for a lot of persons, because I would imagine that sitting in an appointment, like you said, Opal, and I see it talking to people sometimes, they're not hearing one thing that you're saying. It's just whoosh, right through. And it's understandable because it's at a moment in time when there's just so much going on, you know? So what do you say over there, Dr. Spence, about all of this? You're looking at it from a different perspective now. How would you see team, especially as a medical professional, the people who you feel when you see patients come to you all the time, and you can probably pick up on gaps in terms of the kinds of support or care that they may need. What does that team look like for you?
So I think that there's several obviously aspects to teams, and then what we've done is we've talked about the people, but I think one of the things that is so critical is the interaction between all those people on the team.
And we're gonna get to that, yes.
And you know, one of the things that I think is really critical is that when you first meet a patient and their navigator, usually it's a relative, but it may not be a relative, it may be a community friend or a church associate or whatever. Well, I think one of the most important things is to be able to establish trust, because if you're not able to establish a trusting relationship with your, you know, some people say the doctor's a team leader, then boy, it feels like, you know, it may not work out so well. So I think that communication is really critical. And then also not just communication between the patient and the medical team, but between the members of the team. So I know you said something very nice earlier. You can pick up the phone and a friendly voice will say, yes, Patrice, sure, how can I help? That's what I would expect from my colleagues. So, you know, I can pick up the phone and say, Patrice, have a lady with lymphedema, and Patrice will respond. And then, you know, we're lucky to have an expanded team at Hope now, and I can see somebody who has social work needs, and we can call on a social worker. We have psychology support. So that expanded team that Kamala described is ideal, and we would all strive for that, but the team needs to work together as a unit. Yeah. Otherwise, we're not serving, you know, and we look at a different model. We try to, you know, instead of being the paternalistic doctor that says, there, you just go off and do that and just cut off that breast, otherwise you're going to die. And, you know, without really respecting, understanding, to moving to a model where the patient and the family are in the center, and I am part of their team, you know, and I'm honored to be part of your team to be able to serve you in the best way that I can. So maybe a little different take than what we're used to.
And that's an excellent segue into what I wanted to talk about with next, which is communication. Because you mentioned it's critical. There's no point in having a team if each person on the team is in a completely different space and not understanding what the most important person on the team there requires. So we need to talk about communication between team members. What does that look like? Understanding the care plan. So I think that is a big aspect, a big thing I see missing here. Sometimes when I sit and have a conversation with people, I ask them, so do you understand what your care plan looks like? And they just look at me blank. Care plan? What you talking about? Have you had a conversation with your doctor to kind of figure out where you're going on this journey? And I'm not going to say that they didn't have the conversation, because it could have well have happened, but they were not in a space to receive it. And they didn't have somebody on the team who could receive it either. So that is something that I want to bring up going forward, because we could have members on our team, but if they're in the same headspace that we are in, it's not necessarily going to work very well in terms of communication and trust, as you mentioned earlier, the trust aspect of things. So, Dr. Spence, I wanted to bring you in on this here now. The patient's voice, it has to be heard and respected. And if there's one thing I think that people complain to me the most about is, I don't think them hear me, you know, they're not hearing what I want. You understand what I mean? And I know from your perspective, you would have seen a lot of that too, because you may end up seeing people who have are at a very advanced stage. And oftentimes it's because they didn't feel like the system as it was set up would hear what it was that they wanted. Yeah, so in terms of communication.
Yeah, I think that's so critical, Patrice. And I did some work about 13 years ago now. It was a study asking people, because we wondered, in the medical profession, why do people come so late? And in those days, and I will say, because it's 13 years ago, it was very much what you're alluding to, is that people they didn't trust the medical profession. I'm sure a lot of that still exists, but they didn't want to come because they found, the doctor's not going to talk to me in a polite way. They're not going to tell me the truth, and a whole lot of that. And so you go and you take your bush medicine or whatever, and then by the time you do come to the doctor, it's way too late. What has shifted is very interesting, is that people are now much more committed to coming, but we're finding the system is failing them. So those same women are now, there's still a lot of people out there, doing bush medicine and not doing conventional together, because I think we've talked about the integrated approach. But I think, when you come, when you're brave enough to come, and I think, for me, just listening to you guys talking from the user's position, it's very, I think, more medical professionals need to hear, because I think what happens is you only deal with the medical part. When the person walks out the door, you don't really think about how is it affecting them. I think particularly the surgeons, as we say, sure, that's what I do every day, let's just take that off.
Yeah.
And the lack of empathy and understanding, it's a very serious journey that people are going through. So one of the things my trainees know is we sit down on day one and we talk about how are we going to communicate, how are we going to listen, because most doctors are not that great at listening. And we all fall into that trap where we have a plan, and here's the lady, and we're going to just tell her what the plan is and move on to the next person without even giving the person a 5-10 minute. So when I see somebody, my first thing is, I have a lot of documents here about you, but I really want to hear your story from you. And then I can start to understand, okay, who is this person? What are they thinking about? And I think that approach needs to go out through the team, that all the team members need to be able to approach people as human beings and not diseases. And unfortunately, medical school teaches you to approach diseases and forget that there's real people. So a lot of education.
I agree with you. I think that's a big part, because one of the things people say to me too is that it's how the news was delivered to them. It's like, okay, I hear what you're saying to me, but you just drop it on me like that. And then you didn't even stop to process the fact that I was totally blown away by what you just said to me. You just moved on, and I'm left here like, and then I don't know if I can trust this person. Maybe I should think about something else.
Yeah.
Maybe I should think. I mean, what was your experience like with that, Opal?
Well, I think a number of things coming out of the what you have been discussing. I know when Alison was first diagnosed, it was really very hard to hear. But I think when the doctor said, "Oh, we're going to just take off both breasts," I was like, "Oh my God." To a woman, your breast is very, very important. And when he said it, it almost like it drove a knife into my heart and just turned. But so sometimes I think, well, at the start for us on our journey, it was a little insensitive, I think, at the beginning. But as we went further on and we got an oncologist, and also working with Dr. Spence, after a while, we got more information, and persons were, a little bit more empathetic towards the situation and asking questions instead of telling, and also the oncologist that we work with, I was able to call her at any time to just say, this is happening, what do we do? So I found that over a period of time, you know, as we got, when we changed the oncologist and and we're also working with Dr. Spence, the process was a lot easier to manage, well, especially for me, because I mean, the information was a little bit more forthcoming and we'll be able to process. The next thing I wanted to just talk about is the voice of the patient. Or, you know, when we started our journey first, we decided to go the naturopathic way. And so I decided that I'm going to resign from work and I'm going to go with her through the journey. And so the green juicing and everything, I came off my natural diet and went on that diet with her, because I felt like if I was drinking the same things, I was taking in the same things, I would be able to understand how she would feel. So some days when she said, oh my God, Opal, I don't want any more green juice, I know what it meant to her, you know?
Yeah.
And finally, Patrice, when she said, Opal, I really think I want to do chemo. I'm going to be honest with you, I was not a chemo girl. And when she said she wanted the chemo, I said, Sissy, I am with you. Whatever it is that you decide to do, I'm going to support you all the way. And so, you know, the voice of the patient is so important. It's so important. And, you know, for me, there were times when I messed up because I wanted her to do more. And, you know, although she was crying out, I said, no, Opal, no more. I just selfishly, you know, I wanted.
Oh, you're gone on mute, Opal. You went on mute. Still on mute. The technicalities of online life. You're still on mute. Yes,
I'm here.
you're back. You're back.
Right. Okay. So I think the voice of the customer, as you said, is of the patient, I'm sorry, it's very, very important. And we need to listen, because it's not about us. It's about them. It's their journey. We're just accompanying them on that journey.
And I'm glad you said that, because we're going to talk a lot more about that. But before I do that, I just want to bring you in, Kamala, as well, in terms of your communication, because, and your perspective too, because, okay, on your journey, you're someone who has a certain knowledge and understanding about life and able to express yourself well. When you think about someone who may not be able to express themselves as well as, you know, you may be able to express yourself. And in terms of, we have to bring up something like health literacy now. Sometimes terms are thrown around in that initial consultation and the person just sitting there like, okay, yeah. And our culture, unfortunately, we do not necessarily like to ask questions. It's a big thing. Sometimes I have to be pulling questions out of people. Please just say something to me. What do you want? Do you understand what I said? So Kamal, I want, from your perspective, with your level of understanding and everything, how did you feel that communication went for you in terms of your communication with your doctors?
So there were some, most of it went well, I must say, in terms of the information. I'm grateful that I had very good practitioners who, some of them have a natural teaching style, which is kind of rare in medical practitioners. So when I went to my surgical oncologist, for example, there were diagrams, there were charts, there were drawings, there was labeling. It was very detailed. Nice. And no question was considered to be, you know, too stupid or too small. I'm really grateful for that. I ended up finishing my journey the most intense part of my journey in 2014, becoming intent that I wanted to create a product, right? That's called cancer sensitivity training. The information is one piece of it, but in terms of the mannerisms, in terms of the emotional intelligence, in terms of just the sensitivity of several persons in different spheres of the journey, it was disappointing. So for example, I remember having to say to the receptionists, plural, at one of my doctor's offices that I do not appreciate you asking me every time I come, after how many months now, you say to me, what do you have again? In front of people in the waiting room. So I was that patient who decided, I'm not doing this. It's already difficult enough for me to be going through what I'm going through. I'm not going to let your lack of awareness and in many cases, it's straight up ignorance, right? You know, add an extra burden to my situation. I remember going to get a radiology scan done, and throughout the entire procedure ordeal, really, I was never mentioned by name, not even once, right? And I felt like a piece of meat that people were just poking and prodding. So that to me was the major gap in terms of the journey. Communication among my team members got very dicey at some points. The common thread was that everybody cared and everybody wanted the best for me. But of course, as human beings, everybody has a different idea of what that best looks like.
Right.
And because I had two cousins, slightly older than I am, who are medical doctors themselves, one is an oncologist, they were very prescriptive. And I was not about that life all the time. So in as much as I leaned on them heavily for helping me to understand the options in greater detail, I felt like at some point I had to say to one of my cousins, this is my journey. And even if I decide, God forbid at some point, that I cannot do this anymore, it's my decision. And I need you guys to just understand and make space for that. So the different ideas did contend who said must just go natural, who said about them cut off your breast, who said just cut it off. It was just very diverse. And, at some point, I had to be managing the conflict or just checking out for a while and then coming back when I felt I had the strength to do it.
So all of those things you said, it's bringing two things up for me. One, that, and I think Dr. Spence mentioned it earlier, that communication between the team members. Because for me, I mean, I never said what I think my ideal team would look like, but you know, a lot of what you all said was in there. But one of the things for me is, it would be lovely if my ideal team could sit in a room, everybody, and I am able to express to them, listen, this is where I'm at, right? And we're talking about, because I'm mixing teams now, a care team and my main support team, right? Because we have different kinds of teams that surround us on a journey, right? So for me, it would be critical to have everybody kind of have an understanding. If I can't meet with everybody, like I have two main members are me, myself, and my main member of my support team, meet with my care team. So we have a clear understanding of where each person's head is at, where my head is at, and we set that down, and my care plan is put in place. And where I have a meeting at home with my support team, my back at home, and we have a clear conversation about this is who I am and this is what I desire on this journey. It may shift, but I'm asking you to give me the space to allow that to shift. And the other thing that it has brought up for me is communication with my care team. I find that some people complain, and I know the schedules can be crazy, but people complain that I'm having an issue and I can't get through to my doctor. I can't speak to them. I call the office and I hear them going, call me back. I call in and I can't speak to them, and I feel like I need some questions answered. So what can be done then? I don't know, Dr. Spence, what do you think in terms of having a good support team in your office, for example? Like Kamala mentioned, a receptionist who may be able to, or it could be a nurse, you know what I mean, who could probably be that buffer to say that, you know, okay, doc is having a hectic week, but I promise you, I'm going to get the information out and see if I can get a call for you. Or, you know what I mean? Sometimes people feel like there's just this constant wall put up and I can't get access to my care provider.
So you raise, you know, that's a very difficult situation for the person who needs advice. But I have to tell you, it's very difficult. I mean, right now it sounds like we're talking about private sector medicine, but can you imagine all the 50 patients I see,
I know.
2 days at KPH being able to call me up? You know, so what we've talked about at the smaller unit at Hope is having a 24-hour helpline so that people can call that, and there's, you know, some trained nurses who would answer it. And then if they need to escalate, then they would call one of the medical people. But most of the concerns can be, you know, monitored and answered at that level. So, but you know, Kamala, just listening to you talk about the receptionists, Makes my blood run cold, you know, and we realize, I think a lot of people don't realize that the receptionist who greets you at that front desk, it has to be trained, has to be part of the team too, because I've heard people not go to certain doctors' practices, not because of the doctors, but they just can't take the front desk because they're just too rude. And so they're like, listen, I'd rather go somewhere else, you know. So communication skills, I mean, I think we have to call it skills, because it's not, some of us are born being able to communicate a little better, but it's just like for us in medicine, it's just like learning to put up a drip. You have to learn how to talk to people, and sometimes people have to train you to do it. In palliative care, we spend a lot of time doing communication skills training.
And Dr. Friends, wouldn't it also be being a little bit more empathetic? Because say you work in an office where you know that the patients are coming in have a terminal illness. Well, for a lot of persons, it's terminal. And so to exercise that empathy, you know, to say, you know, these are the persons that I'm dealing with. I need to make sure that yes, it's a part of communicating, but just being empathetic to the individual who is walking in to see you, you know, with all of this information in their head. They're not sure how they're going to go. They're not sure how they're going to make it, you know, and just to have persons from and not only the receptionist, the nurses, everybody, the entire team, just offering that empathetic care to every single person who walks through the door. You know, because each individual is really going through a lot, and we, you know, and they all view it different ways. You know, some people have given up completely, other persons are pushing, other persons are very positive, you know. So you know, everybody has their own baggage coming into this space. So how do I treat with these individuals to make sure they feel very comfortable, you know, just being here, because they have to spend so many hours, you know, here doing chemo or, you know, whatever else is being done there. So I think empathy plays a very, very important role, you know, in that space.
You were saying something, Kamala, you wanted to say something.
I was just thinking that, you know, empathy, Opal, is a wonderful tool to have, but as Dr. Spence said, it's like a muscle that we have to build, you know, because not everybody understands what empathy looks like generally and what it looks like in a situation like this.
Yeah.
Because in response to my saying to the receptionist, this doesn't feel good. She said, it's because you're so young. I said, I don't appreciate being reminded of that either. Like, I'm still coming to terms with the fact that I was 30. And in an oncologist office every 2 weeks, you know? So I wasn't angry at her, but I understood that there was a gross gap just in terms of the knowledge. And just to pick up on Dr. Spence's point too, that as a clinician now, I understand fully how difficult it can be to service the needs of, you know, all the people that come through your practice. So Patrice, the health navigators, this is really where, you know, the role is so crucial. Just to have somebody to say, let me make a phone call for you tomorrow. Don't worry. I'll try to reach out to your doc at the hospital, you know?
Or someone on the team, and see if we can get some answers to your questions.
Absolutely, because sometimes crucial decisions need to be made, right? And the information is going to help to guide those. And if there's a lag, it can really be frustrating.
Agreed. And the helpline I love too, because it's just a voice, somebody that I can, because half the time, you know, people are frustrated. Even if they don't get the doctor, they just feel like nobody wants to talk to me. I just need somebody who has an understanding of what I'm going through and is willing to talk to me. Because sometimes it's not a lot of things that they need, you know, but you know what I mean? So that's critical. So we talked about all of that, and I wanted to get to what I think is very, very important. Who should really be the captain of your support team or your team? Who's the captain of your team? Kamala, who you think the captain of your team is?
So I was very clear that I needed to be the captain. There's no other way. There's just no other way. And Althea can tell you that no, our doctors and us are very good friends now, but it wasn't always that way. So I'll tease one of my doctors and say to them, I know that Althea and I are your favorites, but there were some very intense conversations where I was like, listen, Doc, you have given me the information. Just allow me some space to process all of this and decide what I want to do. Even if it's against medical advice, you can write all the disclaimers, but I just need to be okay with these very permanent decisions that I'm making, as it relates to my body. So for me, I think the patient needs to be the head of the team as much as, all the factors allow, meaning mental competence and age. But I think that we need to be the ones to decide, what are you injecting me with? What are you giving me? I felt like many of my doctors just felt as though we have the experience, so this is your best option and you should just accept it. And that was very off-putting for me, because I kept on challenging them to say, I am a whole person. I'm not just a docket on your, I challenge them every single session. We are people. This decision will impact me for years to come. So at least just stop for a second and think of me as a holistic being, as opposed to just a name on your list of patients today.
And you made a good point. I mean, as Dr. Spence, you're raring to talk, so go ahead.
What we need is Kamala to come and talk to the med students or the residents.
You could be right, definitely.
Because people just, unfortunately, medical training is a little bit outdated, and it's only for me when I really came to palliative care that shifts that whole way of approaching people, that I was really, I felt I'd arrived. This is why I came into medicine, to actually look after people instead of diseases.
Right.
And so it's really, it's a kind of a seismic shift that we need. And I think it can be helped by a drip approach, and by, the next time that we have a forum where we have medical professionals, somebody like Kamala needs to come. You're articulate, you've been through it, because most, like you said earlier, Patrice, a lot of people, they don't have the health literacy, they don't have the language, they don't have the courage, because they just feel like, the system will crush them if they stand up and say anything.
That's correct.
I also realize that sometimes it may not be the ill person or the patient. It may really be that close relative who is able to stand up and be the advocate, because sometimes when you're feeling sick, it's very hard to advocate for yourself. And we had this conversation the other night, didn't we? About what when you can't advocate.
You can, and I was about to get into that next. Because generally, yes, you are the captain of your team, but who speaks for you when you can't speak for you? So it's very important to establish that from the beginning, I think. So I know, like Opal, your situation, you were speaking for Allison. Right?
I was, and when I listened to Kamala saying that she's such a strong girl, because when Allison was going through it, I believe that she had to be the captain, but she had to have a very close co-captain,
vice captain.
Yeah, vice captain, because there were times when we went to all the different sessions, and I was the one who had to talk, because she would just sit in silence and the doctors would ask questions. I remember going to Dr. Spence once, and Dr. Spence was asking her the questions and I answered, and she looked at me like, shh, let me hear from Alice. I know here she's saying, you're trying to build trust and stuff. I can understand, her wanting to have the conversation. But there were sessions that I went with her when she said absolutely nothing. And I had to be the one having the conversation with the doctor, telling them how she felt based on what she would have communicated to me. So if you are not as strong as Kamala, it is so good for you to have somebody that is very, very close to you, who you share your feelings with, your emotions with, how you're feeling from the medication, so that, when you go to a session and you're really not in the mood to talk, then this person can actually, articulate, your concerns on your behalf.
And that brings up something important for me, in us having conversations with our family members about who will be that healthcare advocate for you. Because I don't think it's a conversation that we have a lot. I mean, I know I went through an experience with my mother, and she had told me from before that listen, you know all about me. I want you to, and this is what I want. You understand? So I was very clear about the things that she wanted for her journey medically. Well, other things too, but medically, I knew what she wanted. And I felt like I could speak for her. Now, it's very critical that the person that you choose, though, will not try and overstep what you want with what they want, because that's where it gets dicey now. If it means you have to sign on a piece of paper to say, listen, now, I want X, Y, and Z, and I'm saying to you, you're my sister and I love you, and I think you can do this for me. You have the personality, but I don't want you to overstep me now. I need you to understand that this is how I want it done, and will you be able to honor that? Because if you can't honor that, then I may have to ask somebody else to do it. And I think it's the same thing even, I mean, we automatically just assume when we think next of kin, if you're married to somebody, oh, my husband is my next of kin. Your husband may flake under pressure. He may not be able to handle it at all. And you may need to reach out to your best friend who knows a lot about you and who you know will speak for you. So it's going to mean that you're going to have a conversation off air with your support team at home now and say, honey, I love you, and everything else you take care of it. But when it comes to my medical decisions, I have to go with Michelle over here because I feel that she'll honor what I want and she'll be able to stand up under the pressure.
Patrice, you know, that's something I was thinking about too, in situations where there is infighting in the family, and then there is a jostling for the position of who is the captain.
The captain.
You know? And people making arrangements outside of the scope of what we talked about behind our back, you know. Some people reaching out to the doctor off air or outside of the appointments to then interject that, you know, I was reading something on Google and they were saying so and so, and all of these things are real. And I think this really brings up too the value of having even like a family therapist, you know, the mental health practitioner as well, or even a social worker who can help sometimes to balance the conversations. And sometimes it does get into the legal realm, as you were hinting, Patrice, in terms of, you know, signing on a piece of paper, what I said I want and not anything else. So these are some of the important things.
You have something to add, Dr. Spencer?
I was just going to say that you know, Kamala brought up something really critical, and that is the word has slipped me now, but you know, when you have exactly one faction of the family, and I'm looking after a couple of families like that right now, and one set will call you up and say, what's going on, and this is what we think that Dad should have, and the other set is like, no man, you can't tell Dad this. So that's why I really work. No, seriously, and people will often gang you up in the corridor before you even see the patient and say, don't tell him he has cancer. And I'm like,
yes,
whoa, you know. So what I assure the family is that, firstly, I'm not going to lie. And secondly, if I'm going to treat Dad is the one who's going to sign the consent. So Dad needs to understand. And then when you start unpicking it, Dad knows a long time that he has a serious problem, that he doesn't want to tell his elderly wife who is, or well, we're talking about breast cancer, so let's change it around. You know, she doesn't want to upset hubby because she knows hubby can't manage. And exactly what you're saying, you know, so the church sister is the one who is there more for her. So, you know, in the end, I don't think it really matters who is your link person and your side person, but everybody needs to be on board. And I refuse to really engage in that skullduggery of communication because it's very unhealthy.
It's unhealthy and it puts a lot of pressure on the person in the middle.
Yes.
Because I've seen people who will, I'm in a room with them and their family members and everybody's talking this, that, and they just sit there and not in agreement. And when they come out, they look at me and say, I don't want that, Patrice. And but you have to say something. But I don't want to upset anybody. You know?
And then Patrice, sometimes the funders feel as though
funders, I am bankrolling this thing. So listen, this is what I say. Come on now.
Yeah, I'm paying for the medication, I'm paying for the surgeon, so you better cut it off, right? Or you better do XYZ. And that can be a very unfortunate position to put somebody in,
Yeah,
where
I've seen that.
is that you are being kind with the resources. You just automatically assume the leadership of the team.
Yeah, and that is something, this is why I'm saying open family discussion, nothing beats that, you know, because if it's going to be all out war in the room, let it be. Let everybody say, let the person say, and sometimes it may need a mediator, maybe the doctor, that may be a navigator, somebody in the room who is like, listen now, Mary Jane says she wants her experience to look like this. And Mary Jane is just looking to you now because, and sometimes I've played that role before. And it's difficult because people cuss you. I've been cussed out, right? But I mean, in the end, sometimes they will come back around and say, you know, Patrice, I understand, or I'm sorry, or, you know, but I've been in that space where you realize that, boy, this is difficult, you know? So, we have we had some questions coming here, people saying all kinds of things. I'm so caught up in the conversation, I haven't been. I see a question here from Jackie, what disciplines would be on your ideal team? We spoke about that before though. We spoke about medical oncologists and surgeons and physiotherapists and nutritionists and spiritual support, whether it's your minister or, you know, if you don't have that. And I know one of the things that was good at Hope, there was a chaplain. We had a chaplain there. And that's great because for people who may not necessarily have a religious family then, the chaplain was open enough to accept people and have a conversation without putting their own religious beliefs there. Because that's also very critical. You know, we have different understandings, different beliefs. And one of the things I like to find out when I sit with someone is, you know, where's your head at? You know, what's your belief system? I may not share it, but that's irrelevant to me. I mean, we can have an open conversation about what you want, because I want to be sure that if you want to have spiritual support, that you've made that link with your minister or whomever that person is, that you feel comfortable, you know, and not try and push things up, because I find sometimes the team does that too. And I've seen people protest, back off. I said, that is not me. You understand? And then they keep coming at them with the same thing, you know, and those things make people uncomfortable in their process too. So, so that's part of the team. Jackie, we mentioned a lot of different members of the team, a very comprehensive team. So maybe we'll get back into more about that in a little while. Someone is saying here that, I think it's Mary, that people are afraid to say anything because some doctors let patients feel like cancer is a death sentence. Oh, wow. And that goes back to communication again. How do you communicate news?
Yeah, and I would also, if I can just interject, I would also say back to education, because one of the things that we're really getting to understand is that, you know, our medical school does not train people in basic oncology. It's hard to believe, but it doesn't. There's no oncology module so that everybody has a basic understanding of cancer.
Interesting.
And in that light, I'm currently with a team working with the dean of the medical school, who I really have to big up, Dr. Tomlin Paul, who not only is ready to put a module in for oncology, but for palliative care, but even more excitingly into, as we were saying the other day, integrative oncology, so that, or integrative medicine, so that, you know, and then the things that Kamala was mentioning and all the things that are part of our culture that we use, why can't we bring that in and be advised? And not just say, oh, well, I hear say, and I hear say, and then you may be doing things that might be harmful. But if you could actually do that, you know, in a safe situation where people support you to do the complementary therapies along with the conventional therapies, I think I'd like to reach there. But back to the oncology education, a lot of doctors are not well educated even in basic oncology. And so they may even respond like the general public, like, oh my God, you have cancer, I can't really help you. And then, you know, that's the beginning of a very uncomfortable and unpleasant time for the poor ill person. And even, you know, even folks who come to Hope who may have, you know, advanced cancer, when we sit and talk to them and give them information, they'll be like, first time I really have hope. And even though you know that it's not something that you can cure, the way that you communicate and what you say and how you can support people makes a big difference.
It does. It does. It's I see that every day, just how you have a conversation with them, and how you have to lighten it up sometimes too, even in a situation that may seem dire. You know, you can have a conversation. I don't know why people tend to feel when people are going through some of these health challenges that they're every day in this mode of doom and gloom, and it's not like that. Most of the times when I'm having conversations with people who come in to see me, we're laughing a lot, we're cracking jokes, and you know, while we're still discussing some of the serious issues, you know, but recognizing that this person is still alive, you know, we don't want to be looking at them like there's a dead person in the room, because I think that's how some people feel sometimes, dead man walking, you know, like.
Yeah, that's true, Patrice. And I think sometimes to the person who is closest to you, going through the journey with you, sometimes will have to be almost like the person who decides who you will see, because sometimes friends also visit and give you this death sentence. And so sometimes, you know, especially in my case with Alison, there were persons that, you know, when they call and said they're coming by, I had to say she can't take visitors today, or, you know, because when they would come and have the conversations with her, it's like they're telling her goodbye. So, you know, you also had to be like that mediator, you know, to sort of filter the conversations that the individual is having, because you always want persons to be around her who are positive and, you know, speaking life, not death. And as such, you know, I had to be that person to, you know, filter out some persons from calling and talking to her. So as a part of your team, you're going to need somebody who, you know, sort of filters the persons who actually come in to see you.
That is, yes, go ahead, Kamala, go ahead.
Okay, I was just thinking too about the challenges that we have sometimes with patients saying they want a second opinion. I know that some people can be terrified to say that to the first physician or oncologist, because it might be taken as an affront, like, are you saying I'm a quack? Are you saying I didn't study hard enough?
I've heard people say that,
especially because people, even outside of therapy, people will reach out to me with their stories and their experiences. I literally have had a friend of mine send me a copy of the biopsy report, the histology report, to ask me, what is this really saying? So I'm not a medical doctor, which I said up front, and I'm not a doctor, but I have oncologists in my network who I can ask them to look at it, you know, one last time. And the report actually said, with the patient's name on it, that pretty much there is nothing malignant, there is no cancer in the patient's body. And ended up maybe celebrating, and then maybe 2 to 3 weeks after was told that it was a mistake, and the person actually has stage 4 cancer. Right? And so this is not a singular occurrence in my distant experience. Like, there's several persons who have reached out to me with stories like those. And so I always tell people, it never hurts to just get something checked out. If you can afford it, you know, just expedite it as much as you can so you don't lose time. But if you feel that way, several people close to me have gotten late diagnoses because doctors told them things like, you know, oh, your lump is hurting, your cancer doesn't hurt. That's not true. Like, the tumor that was in my body was painful. And my survivor sister also had a similar experience. So people felt this ease that, oh, it can't be cancer then, because doctors say if it's hurting, it can't be cancer. For example, a couple doctors told me, thankfully they didn't put a stop order, but a couple doctors told me that, oh, I don't sense that it's cancer because, you know, you're so young and based on how the tumor feels. And if I was just sitting in a space of, oh, thank God, you know, this is comforting, I would not have pushed to get subsequent testing done. So that to me is something that I always try to lean on people to be assertive. And whoever don't like it is not them body and it's not for them prognosis. So be it. They don't have to like it. There are many doctors in Jamaica. But if you feel like you need to just get something checked again, then do so.
And Kamal, I would like to underline that by saying the only way you can tell whether a lump is cancerous or not is to either take it out or take a piece of it. I mean, I have a young woman at Hope who went exactly through that. She felt a lump, went to the doctor, sent her for a test. They looked at it, so that's not cancer, don't worry about it. And she's 28 and you're way too young. 3 or 4 months later, she wondered why her back was hurting her so much. Yes, and the cancer is now in her spine. Because yes, indeed, it was a malignant lump, you know, but she did exactly that. She's like, oh, the doctor says, so it must be true. And I don't have to worry. And, you know, we are not fail safe, and get a second opinion. Make sure somebody takes some of that tissue. They cannot tell you it's not cancer by just feeling it or looking it on the screen. Not enough.
And it makes a very important point, the point of you being your greatest health advocate, about you knowing your body more than anybody else knows your body. And if you feel like even after you're told, and you need to get somebody else's opinion, go and do it. Go and do it, because only you can feel in there what's going on. I mean, you can tell anybody anything, but they can't feel and they don't understand. So it's very important that we make that point, you know. So we talked about support and supporters, and Opal, you were sharing a lot with us about how you were able to support Alison on her journey. But who supported you?
That was
who supports the supporter?
That's such a powerful question, because I remember having gone to our meetings, our sessions with her oncologist, and whenever I'd go and she would see the stress on my face while Alison is doing chemo, she would call me one time and she would talk to me and she said, Opal, how are you doing? I know it is very difficult for you right now and stuff. And then she would then say, you know, you need to at least take some time off, get some vacation, put somebody else in charge while you get to get some rest. But I was not good at that, because I felt as if I had to be there. And I think you feel almost guilty going to get rest or leaving her, you know. And so, but you're very right. You, as a caregiver, you need to get rest, and you need to have somebody supporting you through that. That for me was very, very difficult. There were times I felt like all the energy was drained from my body, but I had to just pick up what little I had to just hand over to her. So it is very, very difficult. It's a very difficult journey to be on, especially when you feel and as I said, I think that was my mistake. I felt like I had to be there. And I mean, I'm no oncologist side. I don't have any training. It's just that she was like my everything. She was my sister, 18 months older than me. We did everything together. I felt that I had to be there for her, you know. So it's it was rough. It was rough.
I can imagine how. I can only imagine how tough it was. But I know a lot of anxieties and fears, and you know.
And you be strong when everything else
you want to be strong.
is crashing. You had to be strong. You know.
And for us as caregivers, you know, Dr. Spence, Kamala, you too know you're a caregiver in various aspects. You're supporting others. I have learned that you have to find an outlet, because there's so much that you see every day, and it will impact you. I know you're not supposed to get too close, supposedly, to the people you're caring for as you know, a professional, but you can't. I know I can't help it. I won't even try and pretend. I can't, and it does impact you as well. And so we have to find ways to deal with our anxieties and fears and fatigue from just the general workload. And, you know, some of the things you see this week, I had a challenging week, you know, and one of the ways I had to cope today was to go run it out. you have to find ways to be able to manage that and balance your emotions with everything else. Yeah.
And you know, Patrice, I was being asked to share my story recently, and they referenced how sometimes people who are supporting can unfortunately try to make the journey more about them, or at least some points in the journey more about them than about the person who's going through. And it's the unfortunate reality, you know, people don't always have ill intentions, but sometimes it works out that way. That it comes across as if I'm going through this and you want me to be happy because that makes you comfortable, or you want me to always be expressing faith. Oh, I believe God today, tomorrow, next week. Some days you just don't feel so up there. You know what I mean? And to almost demand of persons going through the journey that they fit into this mold of emotional expression or expressing a will to live, you know, whatever it is, it's undue burden. And sometimes it just makes it that gives us more work to do while we're going through it. So there's something to bear in mind, that, you know, start from a place of trying to understand what you can do for the person. Sometimes they may just say nothing, like today I just want to be still, or I can't take your call right now, you know, or I'm sad and I'm sad tomorrow too, and I'm sad Friday, I'm just sad this week, right? I don't want to have any visit. I don't want to smile. I don't want to be forced to smile. Or I just want to eat something random, like I just feel for pasta, you know, or I just feel for some bread pudding.
Yeah.
Or I just want to go for a walk. Random things sometimes, but always start from a place of what can I do for you? What do you need? As opposed to you shouldn't, and why you.
And it's a reminder of whose voice is most important here. Whose voice is most important? I support you and I want the best for you, but I'm not on your journey. As in, I'm not going through your journey the way you are. I'm supporting you in various ways, but I can't speak for you. I want you to feel happy. I want you to get up and move today. I want you to do all these things, but if you can't, you can't. And that's hard for a supporter. You don't want to lose that person.
I think just chip in here that often the opposite happens as well, is that the patient, the ill person wants to do a lot, or, you know, to get up and do the garden or whatever, and the family's like, no,
Too much.
you have to, and it's a definite conversation I have often with people. It's like, you know, you need to trust your relative will do what they can do, and when they've done enough, they will sit down. And they may feel tired the next day, but today is the day they feel good and they want to do whatever it is. I remember my stepfather had a horrible form of stomach cancer, and my mum and him were living in Europe, and he had this friend who would come and say, come and eat oysters with me tonight, Wallace. Yeah, because it was some seafood town or whatever. And my mother would be like, no, you can't go. And he just, I never forget, he turned to her and he said, I'm going tonight because I may not be able to go tomorrow. So just let me do my thing. And so it's that balance, really, you know, supporting the person in because you need to continue your life, balancing the rest and so on. But I think when people get turned into an invalid, and I mean, it's from the goodness of people's heart, yes, but when they may just force them to sit in a chair all day and then they can't really, you know, and you're disempowering people when you do that rather than empowering them. And I think that's very important.
Agreed. That is a very important point to make. Well, I wanted to ask too, Dr. Spence, to share, like, for example, some of the things that as the care team, you can assist the supporter with. For example, I know at Hope there's respite care. Maybe people have never heard of respite care, but I mean, it's not always available and there's not always space, but that is something that can give the caregiver a bit of a break. You want to explain that a little?
Yeah, so we offer what we call a 2-week. It's a kind of a ring-fenced time. Right now it's impossible pretty much because our beds are, you know,
Everything.
shortened by COVID, etc. But, you know, in the good old days, we used to definitely say, you know, there's nothing necessarily worsening with the person. They don't necessarily need an emergency admission, but you can see that everybody's tired. Or, you know, the caregiver needs a break, or they sprain their ankle, or, you know. And so I think it's a service that needs to be much more broadly offered. To give people a break. And, you know, sometimes the ill person wants a break too.
Oh, yes.
Different, and, you know, maybe have their approach in a different way. And I think the thing that I'm really enjoying about Hope is that we are, you know, when I first got there, 2002, I used to just be able to say, well, we have doctors and nurses, that's it on the team. But now we can go physio, you know, counselor, social worker, pharmacy is on board. Chaplain, unfortunately, isn't as present as she used to be, but, and then we used to have the lovely Patrice volunteering, but she's gotten too busy.
I still see people once in a while.
But I think what you have done is you've trained people to do some of the stuff that you were doing. So
yes, I did up there, yeah. Some of the nurses with the bandaging and things like that. You know, wow, this conversation could go on forever, you know, because there's so much to discuss, but we don't have all night. What I wanted to hear from you ladies, I mean, we've talked about a number of different things. If you had an ultimate vision of care and support, I know we spoke about the team and the team members, but an ultimate vision of care and support for persons with breast cancer and other cancers as well. I mean, across the continuum of care. What would that look like for you? What do you think?
Wow.
Wow.
Well, I think for me is having, you know, those persons that we had articulated before, and also, you know, that level of the heightened level of communication among each party, and then on the side outside of the medical realm, you know, so outside of the oncologists and the physiotherapists and all those other persons, that there are a team of persons who understand their strengths, and will be able to so contribute to the patient in such a way that, you know, that adds value to the whole process, the whole care plan, as you talk about. So for example, I'm not the push sweetheart, you know, that I'm more pushing you and saying, get up and let's go walk, let's go do this. But then there was somebody who needed to have been saying that, no, Opal, not today, allow her to rest, you know. So, you know, having persons with these varying skill sets, to be able to, and when I say skills, are more the softer skills, then to be able to add to the overall plan. And I think that for me is a vision of a good plan. And just communicate, you know, tell people how you're feeling, especially as a main caregiver. Tell people how you're feeling, because sometimes you get so overwhelmed that sometimes you yourself become miserable and tired. So you need somebody to step in, because you don't want the person to then feel as if you're tired of them, and you don't, you know, yeah, they're a problem to you, or they're a burden to you. You don't want that. So when you're feeling tired and drained, then you need to step back and allow another bird to lead the pack, you know. So it's that's for me is what my vision would look like.
Well, I mean, I think I would echo everybody, but from the care team, you know, I would like a well-educated, well-trained, communicative, kind. If you know those T-shirts that say, if you can't be anything, be kind.
Yeah.
And if we could even just get to that level, you know, be kind. What does that look like? But I do think that it's, you know, I really do think that there's a place for cancer navigators, until such time as we can have a much more comprehensive cancer service in Jamaica. And I think that the linking up, because it's not that we don't have those services, we do.
But they need to be linked.
They need to be much better linked. And I think that, you know, we're actually doing a study at Hope now looking at the journey of women with breast cancer who came to Hope in the last 5 years. And we're just looking at the gaps between, you know, when did you do your surgery? When did you get your biopsy results?
Right.
And you can see that, you know, people are willing to come, but the systems continues to fail them. And so, you know, my team looks like there's no gaps, that all the care is there, it's holistic, it's empathetic, and well resourced. Nice dream.
Hey, dreams become reality. What say you, Kamala?
I recently, Althea and I have partnered with a company here in Jamaica to offer support to some women who are going through the journey from a mostly financial perspective. But of course, being trained by Patrice, right, and Christine, we have the patient navigator part of it as well. And in talking to one of our physicians about the journey, he reminded me recently, he said, always ask people what they want. Don't ever assume that because you hear that somebody has cancer, that they want this or they want that. And it seems so simple. It seems so counterintuitive to not assume that, oh, they must want help to the chemo and they want somebody to go with them. Some people don't want any of that. And it's important to ask and to allow for whatever spaces to be open to hearing the person's response and not judging it. So maybe they'll give a response, and maybe it's because of lack of information why they give the response. But we have to start from a place of, do you understand? Is it that you're saying, like, seek to understand first, as opposed to imposing that you must fight for your life, man. You have a chance, and your children, and you start from a place of what do you want and why do you want it? You understand? As opposed to trying to put it on. So echoing Dr. Spence's comments, a kind team, a communicative team. And for me, that vision is a very, very necessary one to bring to fruition, but we have a lot of work to do. Because even just bedside manner can just make some people shut down or just feel inadequate to express what they really want. So that's my ultimate vision of having somebody enter the journey, medical journey, or however they choose to to fight or to not fight, but enter the journey and have people who are trained, one, but also empathic and communicative, and who are responsive to the patient's desires. So lots of gaps to fill in, but I believe in it, and in many ways I'm trying, in small ways, medium-sized ways, to have that be, a reality.
That sounds like my dream too. A dream of having all of those little factors in place, but also to have a space where people can access support, not just for the person going through, their personal journey, but for the caregivers, for everybody. I know we do have support groups and so forth in Jamaica, and the whole movement of this too is also to create a supportive space where people feel they can, share their views and have questions answered, that type of thing. And we do have some support groups here, but I feel like we could work on that to make them a bit more inclusive in some ways, and expand some more in other ways. You know what I mean? So that those same gaps Dr. Spence spoke about, if we're looking at the continuum of care again from the beginning, the screening, the diagnosis, all of these things, sometimes there are really two large gaps in between each one of those processes, and it shouldn't be. Sometimes it's a result of some lab work not coming in within a certain period. Sometimes it's just, oh, I didn't have the money and I didn't know that there were actually sometimes some government services that can support me to go and access that next level of care that I need. You know what I mean? So that to me is critical, and I am keeping that vision out there that we can do that. We can bridge that gap. That's why I created this, bridging the gap, to create those pathways so that we can get people the care, that support that they need. So I'm going to say thank you. thank you to my guests, all the attendees for coming on tonight. And if there are any questions that you have for any of my guests or for myself, now is the time to put it out there. Does anybody else have any more questions? Everybody just sit, well, ooh, we have some good comments coming through. Important and interesting conversation. Somebody trying to push me into a field that I wasn't interested in. Over here, doing it in one other way, but not that way. But, you know, I'm really grateful that you all took the time to come out tonight and have this very important conversation. And I'm hoping that the conversation will continue outside of this forum, and that all of us who have a voice will make our voices be heard on all levels, right? Do not be afraid to speak up for yourself, to speak to your doctor, to demand the care that you know you deserve. We don't have to be rude about it. We just need to be clear about who we are and what it is that we want and what we expect from those providing care for us. If there's anything I have to leave, that's what it is tonight. Just be open and clear about who you are and what you want. And I see like a question coming up. Let me just check that really quick. Oh, no, just somebody saying another very informative session. Thank you. You're welcome, Alison. So do any of my guests have some final remarks to leave tonight? Yeah.
Patrice, I just want to echo what has become my motto now, that whether breast cancer or not breast cancer or whatever, my motto now is to live fully.
Fully. I agree.
Fully.
Live.
Just live fully. So I leave those words with myself, with all of my co-panelists and with everybody who's watching. You know, we just have to, breast cancer taught me that, you know, and it's one of the lessons I hold dear to my heart, that we just have to live fully. Live fully.
Yeah.
Kamala, that is so strange, because I was about to quote Augment Mandina, who said, live each day as if it is your last. And you know, whether we are diagnosed with cancer or we're healthy and run up and down, I think we all need to just live each day as if it is our last, and just enjoy your life. You know, we don't know when we're going to be taken out. I've had 5 best friends in my entire life, and 4 of them have died from cancer. So every day, after Alison's death, every night I got to go to bed, I said, God, I don't know if I'm going to wake up. And so for me, I am just working on just consciously evolving every day so that I can just live the best life now. And I'm putting everything in place to do that. And I'm encouraging everybody to do that, because life is too short. And we just have to make a difference in our own lives and in the lives of others, and just be the best that you can be.
Love it. Dr. Spence?
I would just, you know, one of the things that this forum, because, you know, it's not like we're sitting here knowing everything, but one of the things that has been most important for me is actually to hear the voices of Kamala and Opal, and to hear a broader, you know, broader information, what it's like to be on the other side. And I really think that we need to try and bring the two. You know, it feels like never the twain shall really meet. You know, we're kind of cross in the office, but it's like, I don't think that medical doctors, you know, and not just doctors, but that healthcare profession really understands, until it happens to them, what people are going through. And I really think that if people could hear that more, that would be the beginning of, you know, improved communication and empathetic care.
I agree. I couldn't agree more. And I'm grateful that all of you were able to participate tonight, and that the team here tonight was created for me. I didn't do much, really. It was created for me, for this forum tonight. And I wanted to leave one last thing. In particular, yesterday, we would have celebrated or observed World Mental Health Day, but we would have also observed World Hospice and Palliative Care Day. And I couldn't leave here without mentioning that, because I want to say, for all the people out there I know who people refer to as dying, And I've shifted, I'm telling you, I'm calling them living in transition, because we have to remember that people are still living until whenever it is that they're not. They take their last breath. They're living and they have to be respected. They still need and deserve to be seen, okay? They still need and deserve quality care and access to that care. And we have to remember and be sensitive. Those of us who have to encounter individuals who are going through that process, be sensitive. Look at them with love and respect, and look at them as being alive, because they still have breath in their bodies, and we have to acknowledge that. I couldn't go out tonight without saying that. That's very important. So I really want to thank you all once again. And one last little shout out before I go. I would have mentioned at the beginning of our series that Navigating Health Services, one of the things we want to do is offer some resource kits for people on their journey with breast cancer. And I'm happy that some people may know I'm a member of a sorority. I don't talk about that as much on these forums, but that my sisters from the Jamaica alumni chapter of Delta Sigma Theta sorority have come on board to assist us with that. And they will be getting some care packages, some of the supplies for us to be able to supply some women and men who are in need of something to help uplift them and guide them on their journey. Some of the little things that, you know, like Kamal would have mentioned with regards to the team, and some of the things you would have wanted to have, some nice oils for your hair, all these things, you know. So I'll give you more information on that once we get them out. And if you know somebody who is in need, please call, message, make contact with us. Dr. Spence, quickly, I saw somebody asking a question about if you see patients outside of, but I'll get to that. Any other questions you may have or anything like that, just email them and I'll get the questions across. And if there's something that can be answered outside of this forum, we'll definitely do that to any of our panelists here tonight. So thank you once again, everybody. It was my pleasure to have you all here tonight. Have a great night. And as I'm trying to come out, somebody else have another message. Excellent discussion. Okay, that's it. Bless you all. And thank you for joining me tonight.
Thanks for having us.
Thank you for having us.
Have a good night.
Have the great work, Patrice. Nice to sit with these ladies. Good night.
Good night.
Bye.